Here's something nobody tells you up front. You don't need every part of Medicare. You need the right parts. So let's skip the alphabet soup and figure out which letters are actually yours. Medicare isn't a single plan. It's a team. Part A, B, C, and D each have their own job to do, covering a different piece of your healthcare. Learn what each one's actual job is, and Medicare stops feeling confusing fast. First up, Part A. Part A is your hospital insurance, coverage for the moments you're actually admitted somewhere, not just visiting. It may help cover inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. Most people get Part A premium free, thanks to Medicare taxes paid during their working years. Think of Part A as part of the foundation. It's already there for most people. The question is what you build on top of it. If Part A is the foundation, Part B is the MVP. It shows up for the everyday stuff. Part B is your medical insurance, and it's doing the heavy lifting for the healthcare you actually use month to month. It may help cover doctor visits, specialist appointments, outpatient care, preventive services, and durable medical equipment. Unlike Part A, Part B comes with a monthly premium for most people. Part A handles the just in case. Part B handles the everyday. Time for the plot twist. Part C, better known as Medicare Advantage. Here's the mental shift. It's not a replacement for Medicare. It's a remix. It's a different path to your same Medicare benefits run through a private insurance company that Medicare has approved. Most Medicare Advantage plans bundle your Part A and Part B coverage into one plan, and many throw in extras like prescription drug coverage, dental benefits, vision benefits, hearing benefits. It can be a great fit for the right person, but the fine print is in the network rules. Before you enroll, you've got to know how those work. Rounding out the team, Part D, prescription drug coverage. Here's the twist nobody warned you about. Original Medicare generally doesn't pick up the tab for most outpatient prescriptions. That's exactly why Part D exists. Just like Part C, these plans come from private insurers approved by Medicare. But here's the catch. Not all Part D plans are created equal. The drugs covered, the pharmacies you can use, and the costs can all shift from plan to plan, which means the real decision isn't whether to get Part D, it's which one. Quick gut check before we move on. Medicare supplements use letters too, like Plan G and Plan N. Those are Medigap plans, Medicare supplements, and they're a totally different thing from the parts we just covered. Medicare only has 4 parts, A, B, C, and D. Everything else with a letter is something else wearing a similar outfit. This is the moment it all comes together. Original Medicare is the starting lineup. Part A plus Part B. Nothing fancy, just the foundation. From here, you've basically got 2 roads. Road 1, Original Medicare teamed up with a Medicare supplement and a Part D plan if you need your prescriptions covered. Road 2, skip the supplement and go with a Medicare Advantage plan instead. That's Part C doing the bundling for you. Here's the thing. There's no universally better road. The right one depends on your doctors, your meds, your budget, how often you travel, and what actually fits your life. Here's what I've learned after years of doing this. The people who feel good about their Medicare decision are the ones who understood the parts before they picked a plan, not after. Remember the foundation we talked about? You can't build the right house if you don't know what you're building on. You now know what Part A does, what Part B does, what Part C really is, and where Part D fits in. That's the foundation, and you've already got it. If Medicare Parts A, B, C, and D finally make a little more sense, that's the goal. Start with the article linked below, take it one step at a time, and don't let the alphabet soup boss you around. I'm Robin Dall, and that's Medicare minus the headache.